Hey guys, I'm Sebastian. I'm going to cover sciatica today in association with sex. I've already covered one with female versions, but obviously we're going to cover male today, or I'm going to use male-female models, so basically in association with this scenario, but obviously it can be extrapolated to anybody because biomechanics don't care about gender. So what we're going to do first is we're going to talk about the mechanics of sciatica a little bit, and so you can understand how the mechanics in certain positions might be favorable when just moving to a different position. And so sciatica, if you take a look right here, the sciatic nerve goes from my toes, behind my heel, up the calf, hamstring, back, so on. It's actually part of a whole nerve bundle that comes out of the spine. As I start to actually extend the knee like this, it starts to stretch this nerve back here, which can elicit symptoms on some people. It can create tingling and numbness and so on, and pain in the bottom of the foot. And usually it increases too as people cock their toes back. As you look down here below, right in this area, as I cock the toes back, it actually tensions the band even further right here. What also, in some people, because mechanics are different with some people's sciatica versus others, is bending forward can increase it, or sometimes bending backwards can increase it. In this scenario, again, we're going to use man-female model, and also, too, we're going to talk about in this scenario where bending forward from the low back and hip tend to increase it as well. So in this situation, at least a lot of people who are at least in the male situation, there's not a lot of positions that are especially stretchy on the hamstring or the knee, such as in a female model or in the men-female scenario, lady on their back with knee extended and in this position is a little bit more stretchy while the spine remains straight. With the man-female model, men generally don't have that type of scenario. I was looking for a situation where that does happen to men. The closest thing is maybe like, they call it like a lotus. So in this scenario, I would be on the bottom in this position and it'd be female on top. And this is obviously bend knee would be the thing. However, it's probably more common for people to have the rounding create the issue more so than the knee straightened, at least for men in this scenario. So spooning, I'm going to use my little spoon partner right here. And so spooning, camera, come on top for me, and I'll flip over to the other side, just so I don't crush the mic. And so spooning in this position, all right, so the person behind with the round in their lower back might be one of actually a really triggering thing for them, all right, because that round is enough to sometimes create the raging leg pain, all right. So what might be better is actually changing into more of a doggy position or like a missionary, okay, and I'll show you the reasons why, all right. So in more of a doggy position here as the person behind, this position allows a little bit more lumbar spine arching. You can probably even tell with my back right here. As I'm in this position already, you can see my spinal erector muscles right there actually working to help extend my spine, all right? Also the glutes also help in this scenario as well. So there's a lot of extension happening in the spine, which generally helps. There's actually an exercise that we do in office here in a performance place called the stallion, which is just like this. It helps drive that movement, which helps settle the spine down, and it helps create a reduction of sciatica. So this is one. The second one is missionary as well. Missionary usually with some type of hand or elbow prop usually helps out with kind of like this position is so. We've noticed that a lot of men that come in that have leg pain or sciatica actually feel very comfortable in this position. We call this the prone prop position, and it's actually part of the therapy that we actually give. So to boil everything down, don't be married to a certain position if you are dealing with sciatica. There's lots of ways to still have a good, healthy sexual relationship while you're still recovering. And I know sometimes you can trigger it with sex, but at least if you have some easy modifications to go back to, then you can still have a good experience. If you're having problems, we would love to help you out through this. We specialize in seeing people with sciatica and low back pain. We're in Costa Mesa, California. We're locally world-famous chiropractors, and as you see, we try to send you home with some cool things to mess around with in regards to rehab exercises and things that really put you in control. All right? So if you're looking to get better, we'd love to help. We have an article below. I don't know if I mentioned it earlier. There's a full-length article below in the link description, which will give you more details of modifications for men, women, and a little bit more position specific, all right? So go over that. We'll see you guys next time.